Let's head into the Zoom room where Dr. Ann Pobutsky is sitting by. Good morning, Dr. Ann.
Good morning. I can barely hear you.
How about now?
A little better.
Okay, right on. Doc, so I guess we'll just start.
No, I can't hear you.
Okay, how about now?
Really low. I've got it on 100% here.
Okay, how about now?
No.
So you can't hear me now?
I cannot hear you.
Can you hear me now?
Barely.
That's weird. They're fiddling with stuff here, Doc. So I guess we'll just start at the beginning. What with numbers and all that? What are you? I know you're crunching a bunch of data, so I guess just give us an idea what you're working on.
Based on the sit rep, there as of last night, there were 7,528 cases. We had 0 local cases reported yesterday, and 7 from travelers.
Wow.
Those happen to be DOD personnel coming in. In the past week or so, we've had, and we know it's still out there. It's just we didn't have any reports yesterday out of 600 some tests. 0 local cases. So Guam's doing pretty well. In the past couple of weeks, we had a couple of church groups with cases. Those seem to be always cropping up. The issue of large gatherings, I assume, and people singing, praying, and that's a great way to spread respiratory viruses. An increase in some of the military cases. We're not sure. We know 7 of them from yesterday were guys coming in. We work closely with the military on trying to squelch those kinds of fires that light up. We do know it's still out there, but we're at a really good point. Moving forward, I think that issue of it's going to come back in. Even if we do the best that we can and the CAR score is 0, how do we prevent it from coming back in here? And that's been the issue all along. It started with travelers back in March.
Right.
We had our surge that was contributed by military guys, and then people traveling, coming home for funerals, and et cetera. So that's a big issue moving forward, even as we start vaccinating everybody and try to. We've done some updates on the website. The dashboard now includes the number of people vaccinated, as of the latest numbers, and some characteristics on the deaths. So that's been updated, and our team continues to just report the daily numbers and try and keep on top of this as cases crop up and try to mitigate it, because I think the next big issue is going to be how do we deal with travel coming in over it's been a year almost.
Yeah.
And how do we deal with this second year? And the kids are back in school, which is great. So we're watching that to see if anything happens in the next few weeks over, the kids getting back. There's talk of trying to prioritize some additional groups for vaccination, including DOE staff and teachers and so on. So that's where we're at.
Doc, if you could refresh our memory, because it's been a minute, but there's Operation Sea Dragon exercise that's going on, I think, I want to say next week, but there's going to be all kinds of military coming. So with these 7 DOD cases, what's the protocol after they test positive? And then where are they testing positive at? And then what happens after we get those results?
Well, those 7 who came in were tested at U.S. Navy Hospital, and then they do the follow-up and on that. And we work also closely with Anderson. We have a weekly call with the military to keep tabs on what's going on. Yes, remember the big ship that was here? Yeah. It's just something we have to monitor and contain.
So let me ask you this. So the travel coming in is really something to look out for. And they're also talking about changing up the quarantine, right? Have you been part of that discussion? And do you think it's prudent to change up the quarantine given that we're now really watching our ports of entry for new cases of COVID?
Well, the quarantine is still in progress. So until they, so we're still catching people in quarantine. We're catching these military guys. There's discussion about lifting it, but it hasn't been lifted yet because obviously that's a big concern because we have to have some kind of policy or protocol to deal with travelers. And people are talking about it. That's all I know, is that it's under discussion and trying to move forward, how we test people and so on. Right now, we don't have enough. I mean, we can't test everybody who comes in, but ideally, I think that's what, there's got to be some way to either test people. Well, they test them at quarantine, of course, but they're trying to develop some kind of a system for travel, because that's going to be the big issue, especially with what's going on in the U.S. And that's not going to abate anytime soon. So that's our biggest worry. Even though, there are local cases that, we're trying to keep a tab on that, but that'll be the next big issue, I think. Travel, mitigation, and of course, trying to vaccinate everybody.
What was the deal with the other day when we had 30 cases out of 1,000 some tests? You have any additional information about that?
That was probably over a week's time. That wasn't one day.
Okay.
I know there was a little uptick last week, but it wasn't 30. That was over several days, and it probably included a weekend.
Right.
Our numbers have been pretty good, under 20 daily for the past week or two. And as I mentioned, there was a couple of church groups that we had issues with, and I believe there was an agency, a Guam agency, Revenue and Tax had to shut down because there were some cases.
Right.
So we've been on top of those.
Yeah, my daughter's a dentist had COVID, and there was a whole deal where they tested everybody at the office and stuff. So I know that the number of positives are down, but I think anecdotally, the people who are positive, I mean, it's like they're getting positive in high impact areas like, Rev and Tax, right? So we might not see a lot of positives, but the ones we are seeing are shutting down government agencies. Dr. Ann, this is kind of a random one, but we had a comment here. Is there an issue with people coming in from the States just to get the vaccine here on Guam? If you follow national media reports, they're having major issues rolling out the vaccines and getting people vaccinated. So is that something you heard about, Doc? Or
not yet? The people have to present an ID. I'm sure if somebody comes in with the Nevada ID, they have to prove residency. I think they have to have a local ID. I don't know about that. I haven't heard anything about that. I do know there were stories in Florida about people flying in from New York just to try and get the vaccine and line up in Florida, but that has not presented itself as an issue yet.
You're right. And you want to kind of talk...
Again, we're mostly doing Manamco and local first responders and healthcare workers. Presumably they all work here, and we haven't seen any, elderly people coming from...
Dr. Ann, let me tell you, it wouldn't even be far-fetched. I could totally imagine somebody here saying, "Oh, Auntie didn't get the vaccine yet?" Yeah, no, let her fry out. We'll get her the vaccine. If you want to put it in context, Dr. Ann, because if you do read national reports, they are having major issues getting a lot of people vaccinated. And I want to say that given all the hiccups and speed bumps that we had, with the first few vaccination clinics, and, I'm not one who hands out praise easily, but I want to say that we're doing pretty good with the vaccination effort. And I'm saying that totally objectively when you look at other areas.
Oh yeah, I think we're ahead of the game. We're following the guidelines of the there's a advisory committee on immunization practices, and then Guam has a advanced vaccine and antiviral policy committee that meets every week and as needed to tweak this as we're going. As you notice, they put all the cars outside, up at Okoto. They got rid of the line outside the high school, and they are basically have a system where people all come in and they line them up with their cars and they get them through. It takes several hours, but people are getting their vaccines. Yes, we're doing a much better job, but we have a smaller population.
It is
so
what it
that's
is.
good.
Yeah,
that's good. Maybe we'll get everybody vaccinated and we'll get herd immunity soon.
Doc,
several months. It's going to take several months. We've got to follow, step by step each group and make sure people get their second shot for the two that need the second shot, and then there's probably more vaccines on the way. And we don't know what's going to happen because there's a new administration in Washington. Maybe they'll speed it up.
or slow it down. You never know. But
You
doctor,
just don't know.
is there a danger at all? I mean, not danger is not the right word, but we've got a bunch of vaccines. We were able to get a bunch at the beginning. Is the flow of vaccines into Guam going to be consistent enough for us to meet these goals that we have to get everyone vaccinated?
What was the exact question? Do we have enough supply?
And are we going to keep having that supply consistently until we are able to reach our goal?
We hope so. That's actually not a question for me. That'd be a question for Annette. And I do believe we're on some kind of a schedule where we get so many either per week or per month. I don't know how the logistics of that work, but I think we're good.
Right on. Wow. You never hear Dr. Ann really say we're good, right?
Well,
What year is this, guys? What's going on? Doc, let's talk about the variant. What have you been reading about this variant of COVID-19, the mutated strain? There's like a UK variant, South Africa variant. Is there a Mong variant? I don't know.
well, there's actually 4 different variants that they're trying to keep tabs on. We know the one that from Britain, and it's now in the various places in the States. It just happens to be a little more contagious. It doesn't mean it's more severe, but I don't know about the structure of these viruses, but it's more contagious, so it'll spread and there'll be more infections. So we don't want to see that. What we are doing here, and what the CDC is doing, is requesting all the states and territories to send samples of what we're seeing here to the CDC for molecular sequencing. That's part of and we're just starting to do that. So are all the states, because they're going to sequence it and find out what strains are going around where, so they can keep track of it. And that's going to be probably an ongoing process, because they think it's kind of like the flu. You know how every year there's a new flu vaccine, because there's different strains of the flu that circulate in different parts of the world. And every year the CDC has a group that gets together every end of May, early June, and they get together and they look at all the strains going around and they decide what's going to be in the vaccine. It could be that was what's going to happen with coronavirus in the next year or two, that maybe people will have to have a booster because they'll have to tweak the vaccine because of these different strains and all of that. But from what we know right now, and maybe we don't know a lot, they think the current vaccine will protect people from that variant. There's another one in South Africa that they're also worried about. So there's thousands of strains. Viruses always mutate. So there's only a few that they're kind of watching because of the particular properties. And again, they're going to do molecular sequencing all over the U.S. and Guam is included in this. So we're going to be sending our samples to the CDC. And we'll see what's circulating here.
Right. So as of now, we don't have a way to tell if someone comes in and they test positive for COVID. We don't know if it's the regular COVID or the new COVID.
Nope. Sorry.
And we're not alone in that, right?
No,
yeah.
Of course not.
All right. Doc, what else are you working on here?
We're working on trying to write up some of the data on the health disparities that we've been seeing, and kind of looking at this whole issue of COVID-19. It's not just a pandemic, it's called a syndemic, because initially people thought, oh, we're going to see flu and COVID. It's like, no, what we're seeing is two categories of disease interacting in the same population. So we have all these people with chronic diseases, and especially diabetes. So we have this kind of non-communicable disease that puts people at risk for severe outcomes. So that's a disparity. And those kinds of issues are not just here, in Hawaii as well. For example, Pacific Islander populations have a smaller proportion of our population, but higher number of cases and deaths. And that's because people keep using the term, I think I talked about this before, multi-generational households. Well, a lot of us live in multi-generational households with 3 generations. There's also the issue of overcrowded housing, where we have a whole set of issues related to this that are related to housing and poverty and overcrowding. So if you're in an overcrowded house, there's no way you can social distance. There might not be a way to keep someone isolated at home if they are. So these kinds of issues go beyond just the medical component of a pandemic or an outbreak. They're called the social determinants of health, and they are huge, have a huge impact on disease.
Hey, when public health sent the rapid engagement team out to Santa Ana last weekend, 0 positives. Were you surprised with those results, Doc? I mean, I'm pretty sure you're pleased with them, but were you surprised?
I'm sorry, which one was this? Was this a couple weeks ago?
This was last weekend, Santa Ana. They sent out the RET, the rapid engagement team.
I don't pay attention if there's 0 cases. And that's great. I think it's wonderful. They can do that and
keep doing it, right?
That's wonderful. I think it's great that there's none. I'm only paying attention to the positive.
All right.
Right. We're also doing a lot of grant writing right now because there's some additional money for our program and to enhance some of the lab money for shipping off these specimens. And then there's a new grant that we're doing. So I have the team working on the data. I'm trying to write things right now. And so we're just keeping track of what's going on, and we're trying to write some more grants to get some more money to, and let's just hope we don't have a surge, because then everybody will be just doing that, addressing the problem.
Right. And let's talk about that, the realities of a surge, because I feel like we've really turned the page with the vaccination, just people's top of mind, state of mind right now. A lot of people feel like it's over. So when you mention the specter of a surge, let me just ask you, how realistic is that? What are the odds, and are we prepared for it?
Well, I think we're better prepared than we were back in August. The issue, again, becomes that issue of travel. How do we make sure we keep it from coming back into Guam, and then seeing what happens with schools opening up, and then just kind of staying the course for a little while, keeping the bars closed, making sure churches aren't having huge, gatherings with people praying and singing and spreading virus. And again, the travel issue. And then we have to see what happens when the schools open up.
So, Dr. Ann, if I go to mass, do I sing or do I not sing? Because I sing, but I don't sing so loud, and I'm wearing my mask. I just want to be, I want to be, sure.
I don't know what they're doing in the churches. Do you go to mass? Have you seen people social distancing and wearing masks?
Yeah, it's actually pretty.
Well, they need to keep doing that. Yeah. The case I'm talking about were within the past couple of weeks, where there was a church retreat. That's not social distancing. That sounds like a revival or something, where you have a whole group of people and they're probably singing and praying, and then
they're bringing out the rattlesnakes.
Brown tree snake.
They're bringing out the brown tree snake. Ooh, boy. Sorry. It's fundamentalist light. You start baby steps, start the brown tree snake, and then.
I'm pretty sure, Chris, that's not what the good book meant when it said make a joyful noise unto the Lord.
Well, the problem is churches are good places to spread respiratory viruses because of the singing and praying, and if you're not wearing masks or you're not social distancing, you're having a retreat, you have a group, and you're all eating together. It's like, well, that's asking for a spread of if a virus is there. Yeah. So and we're just keeping an eye on these kinds of things, and we hope the bars stay closed. Sorry, folks.
I mean, I don't know. I feel like the bars are closed, but you can go to any number of restaurants and have like 20 beers and order some nachos, and they're open. So it's interesting to me, Doc, to see how many of these businesses that were strictly bars back before the pandemic hit have really evolved and maybe thrown a few things on the menu so they're able to open. But yeah, you heard it from the territorial epidemiologist, and if she's saying keep the bars closed, then good luck with that. Doc, so back to I think it's interesting that you bring up the church events being spreaders, because we did see a release out of the Archdiocese, but it's interesting that the spread in this case came from outside the Mass, right? So I guess at the friary, there was one a priest who had been positive, right? And that has led to the closure of 5 churches, presumably for the next 2 weeks, but until further notice is what the release said. So, I mean, it kind of seems to me like with this church retreat and with this case at the friary, and just kind of knowing what people are doing out there, people are letting their guard down, right?
I don't think they should. I remember Korea early on in the pandemic. They kept their numbers down, and then all these people went to these religious gatherings, and it flared up again. And that's always a problem, because religious gatherings are, I know people want to do their thing with the religion, but to keep it toned down, and you have to follow protocols.
Yeah.
That's all, because we don't want to see any more spread. We don't want to see this flare up again.
Yeah. And I mean,
and it's still out there. It's still out there. Just because we had 0 numbers in one day doesn't mean anything, because we had the travel cases, and then we've had some of these church groups and an agency where people all work. So we still have to be vigilant. It's not over. These things flare up. They go in cycles. So we just don't want to see the next cycle. I don't know if Guam can be good at containing this. We hope so.
Well, I mean, I got to give our people credit, because, Thanksgiving, Christmas, New Year's, all of these like major holiday events went by, and we didn't see the big numbers that.
I know. Isn't that great?
Yeah, I feel like it's really awesome. Doc, we had Lieutenant Governor on earlier in the week, and, full disclosure, he is not an epidemiologist, but he did talk about bubonic plague in China. I don't know. Is that something that's on your radar?
There's always bubonic plague in China.
Oh, so that's a regular. That's just a Tuesday in China.
Well, there's nasty things all over the place. Somebody was talking about Nipah virus again. So people are watching these infectious diseases. That's great.
Yeah.
But right now it's still COVID. I haven't seen bubonic plague here yet.
What about STDs? I know every time you come on, we do COVID, and then towards the end, you're like, yeah, STDs.
Well, I have some numbers here if you want to see it.
Yeah, let's get some numbers out there. Guys, if you're eating breakfast, brace yourself.
All right, I'm going to share my screen. Oh, you have to open up my screen.
Oh, yeah. Okay, go ahead, Doc.
Okay. Is that good? Can you see it?
Not yet.
Not yet, Doc. Oh, there you go.
Okay, here. Yeah. Oops.
Okay, guys, don't freak out. This is not COVID. Okay, this is STDs. That's so actually do freak out.
Sexually transmitted diseases. This is chlamydia and gonorrhea and syphilis, and you can see it's going up. Syphilis kind of just smolders. Chlamydia was big. Gonorrhea was a bigger issue, and then it kind of switched over to chlamydia, which is a little bit nastier. And these are up through 2019. We don't have 2020 numbers yet. I wonder if I have also Hansen's disease. No, that's not.
Ooh.
Hansen's disease. That's leprosy, right?
I don't have it up. No, just deal with the STDs. This is a good graph. I can show you that another time. Just these things never go away. That's why we have a whole section that's just STDs, HIV, and hepatitis. And then we have another branch that just looks at TB and Hansen's disease. So you think infectious diseases, well, these are a little bit more slow moving, but this is a big issue.
Yeah, let's talk about, Doc, what are the symptoms with chlamydia, affectionately known as the clap?
No, I think syphilis, isn't gonorrhea the clap?
I don't know. I'm actually glad to be very, inexperienced with these types of things.
Me too. And the issue is that we just don't know if chlamydia was out there. We didn't really know how to maybe test for it. This goes back to 1968.
Wow.
So a lot more problems with gonorrhea and syphilis,
right.
Especially gonorrhea. And then it just kind of switched.
Yeah. So what are the symptoms of chlamydia for those people who are listening this morning?
You need to get the STD people on here.
Oh, you don't have like a cursory knowledge of...
Well, just that use a condom.
That's it. There you go.
That's the best way. use condoms. I mean, these things are nasty, and you have to have treatment for them. And some of them, it's just nasty.
Right. So these are the things you catch. They just don't run their course and go away. You got to go in and be seen and all that. Right.
Well, you should get someone from the STD branch to talk. Get Vince Ogden to come on.
Right. I think we'll do that.
And you might want to talk about TB and Hansen's. That's another big issue we have. Those are the biggest. That's why they have their own separate program. Whereas right now we have a COVID program, but infectious diseases includes everything. But STDs and TB and Hansen's have their own program. Right now we kind of have a COVID program. That's what everybody's dealing with. But this is a once in a century kind of event.
Right.
We hope. We don't want to see this happen again.
Amen.
We don't want anything else coming in here like plague or cholera.
Right.
Or what did you talk? What did you say?
Bubonic plague.
The bubonic plague.
Yep.
Right.
As long as
It's
we're
published all the time in China, and Asia, I believe. It's there.
Okay. I just think when people read these articles about the next thing or any kind of illness, it goes from like 0 to COVID level event so fast, right? Because people are just more in tune. Doc, thank you for your time. Anything in closing here that you want to tell the people of Guam?
Just stay the course. We're still watching it. There's still flare-ups. We have it. It's coming in from outside. We want to keep it down here and try to prevent it from coming in, and just bear with us until everybody, till we get herd immunity. That's what we're aiming for in the next, I don't know how long it's going to take, 6 months to get most of the population vaccinated. It's called herd immunity. We're trying to get herd immunity, which is also called population immunity. So this would be where we get immunity through the vaccinations. And so just bear with us and when it's your turn, go get your vaccine and keep an eye out. And you still have to wear your mask. You still have to social distance. You can't go to the bars, So this is going to take a while. Pandemics usually last several years, and we just finished the first part, 1 year. So, yeah. But this is the vaccine was developed in record time, so that's really, really good.
Doc, let me just ask you. I was lined up somewhere yesterday, and there's a place that there was a line outside, but the guy in front of me didn't have his mask on, right? And we were social distance, but I'm curious, how do you handle that when you go somewhere and someone doesn't have a mask on? How do you politely say, "Yo, where's your mask at?"
I don't know. That's like social norms. Actually, there was some commentary about the inaugural ceremony where all these politicians, and they were mostly male. Even I don't know if it was Obama or Clinton, and then they were walking around like this.
Yeah.
It doesn't work like that. You have to cover your face. And I don't know if it's a guy thing or you can watch. You can look at that on YouTube or something. The inaugural ceremony. It's like, I don't know. Can you politely say, "Excuse me, you're putting us all at risk"?
Yeah, but you never know which one of these. It's like a landmine.
People wear their masks. They're really good here, and mask wearing is not going away. It's great. That's why we're seeing. We haven't seen a lot of flu. I mean, we're still looking for it, but people are wearing masks. It's a great thing. That's what they do in China all the time because there's so many respiratory diseases over there that some people wear masks all the time in China.
Yeah.
And Taiwan and other places. And maybe that's the new normal. I really don't know.
I like it. Like I always say, I think I look pretty good with 50% of my face covered.
Well, you have a nice mask.
Yeah, it's Crowns. Thank you, Crowns. Dr. Ann, thank you for your time. So it's not over. Do your thing. Watch your distance. Wear your mask. What's the other one? Wash your hands. Sorry. Wow, I can't believe I forgot that. I'm just so used to doing it. That's why.
Wash your hands.
Also use protection.
More important than the social distancing.
There you go. Thank you, Dr. Ann.
Okay.
Okay, we'll see you. There you go, Dr. Ann Pobutsky. Always a great interview here.